Well, good afternoon. It looks like we've solved our technical issues and are communicating with you today, and that's good because today is the day we've been working toward for the last 2 weeks. We have finally busted loose the supply chain on vaccines for the city of Detroit, and I'm very glad to say everybody in this city, 65 and older, can get a vaccine. We have got triple the vaccinations at the TCF Center starting next week. The appointments for next week are open, 313-230-0505. There's 80 operators who are waiting right now. No restrictions, no problem. You're 65 and up, dial the number, you'll get an appointment in the next couple of weeks. As far as I know, we are the only city in the country now where anybody who's 65 years old can just call, get somebody on the phone, and get that appointment scheduled in the next couple of weeks. And it's because Elisa Malil, who's here with me, who's running the TCF Center operation, has promised us that when we move from 5,000 vaccinations this week to 15,000 next week, it is going to run without a problem. And certainly the feedback that I've been getting from everybody who's been through the center has been phenomenal. The speed, the friendliness. It is a place of joy when folks are so happy and so excited. And I know the horn honking is something that anybody who's worked there takes great pleasure in as people get their vaccines. In order to do this, we had to extend the hours. So we've added 3 hours a day. We're now starting 8 in the morning till 7 at night starting next week. We had to do that to accommodate the extra vaccines. We've been waiting to do that for a while. We just couldn't get the supply. We are also opening our appointments to a new category. And that, I think as you know, hospitals have vaccinated their frontline workers. But I've heard from lots of other healthcare workers that were left out. And so today, vaccines are available to anybody who lives or works in Detroit in any healthcare setting. So if you work at a doctor's office, you work at a dentist's office, you work in an optometry center, up until now you probably could not get your vaccine. Today you can. People working at chiropractors, veterinary centers, OTs and PTs, occupational therapists and physical therapists who are going into people's homes. Anybody who is working in healthcare who lives or works in Detroit, you can now call the number and you can get an appointment too. So I know there were folks in the healthcare field who felt it wasn't unfair that those in the hospitals got it first, and they were face-to-face with patients, and they couldn't get it. And that's not just the nurse, that's the person, the receptionist in the office who greets the patients as they come in. If you're interacting with these individuals, you can call, and when you show up at TCF, you show us your pay stub, your employer ID, some type of proof of employment that you are working in the healthcare field, and you will be able to get your vaccination. We have at our dashboard at DetroitMI.gov a daily update of what we're doing, and the Detroit Health Department has been as efficient as anybody in the country. When we get the vaccines on any given day, 80 to 90% have been injected in the arms of our residents. Our problem has been we have not been able to get the vaccines into the health department, something we've talked about over and over. And I want to thank the governor and the Biden administration who in the last 48 hours have taken the action we needed to close the vaccination gap. All I was asking for was for Detroit to get its fair share, but the way that vaccinations are distributed in the city is different than in the suburbs. And so if you look at what's happened, the state started out with hospitals vaccinating their own employees and then went to vaccinating their patients. That made perfect sense, except that the way they've done it is that they have had their patients log on to their personal health records online to schedule an appointment. A lot of Detroiters don't have computers. A lot of Detroiters don't have a primary care doctor. This method wasn't working. And the result is that today about 8% of the residents of Michigan have been vaccinated, but only 3% of Detroiters. It isn't because Detroiters don't want to. We've got 10,000 appointments booked up for the next month. It was because Detroiters were not nearly as able to access the electronic medical records for appointments as the rest of the state. The governor has understood this. She's been on top of this the last couple of weeks, as has Dr. Jonae Khaldun. But unfortunately, the last 2 weeks, the feds cut the state's supply unexpectedly in half, and the state didn't have any ability to fix this problem. And we kept saying the same thing, and I got to give DMC and Henry Ford leadership credit. They backed me on this. They said, if you're going to get vaccinations up in the city of Detroit, you need to run it through the city, through the TCF Center, because the city will get Detroiters vaccinated far faster than doing it through the hospital system. They backed us on this, and I just said, we need 15,000 doses a week coming directly to the Detroit Health Department, and we will get them into the arms of Detroiters, and I'm really pleased that starting next week, we have that allocation. It's gone from 5,000 to 15,000. That doesn't mean Detroit overall got more. It means the Detroit Health Department got more, and because the Detroit Health Department is successfully vaccinating people, you're now going to see a big difference. So in D.C., I've talked to Jeff Zients, who's running this program for the president. Dr. Marcella Nunez-Smith was very helpful, who's leading the equity team, and General Perna. And on the governor's side, the governor, Dr. Khaldun, Trish Foster, Elizabeth Hertel, they have been talking to D.C. continually about the fact that the only way for Detroit to catch up was to have a supply directly to the Detroit Health Department. So now we've got what we wanted. We are going to triple the vaccinations next week, and Denise Fair, our great health director, is going to double her outreach, and she's going to talk about that in a minute. So, who's eligible? If you are in one of these 8 groups, you can call now, and one of the 80 Rock Connections operators will help you. Anybody age 65 or older. K-12 school teachers and employees and child care workers. We've vaccinated, 4,000 or 5,000 DPS and charter school teachers and employees so far. I know that a number of you were concerned you were being scheduled 3 and 4 weeks out. With the extra slots next week, you should call. We can get you in. I know the teachers are anxious to get their 2 shots in before March 1st. This is going to allow us to get to more of you more quickly. Our employees in the city of Detroit who are coming to their job sites, postal workers, they did not waste any time in signing up. They're just doing great work. Federal and state law enforcement officials have been coming in, members of the clergy interacting with their congregation, funeral home and mortuary service workers, and today, the 8th category, any healthcare worker who lives or works in the city, somebody that works at any type of healthcare center. If you are in one of those 8 categories, you can call now, you will get an appointment, and we are going to start to see huge crowds. And if you've been over to the center, it's efficient, but Elisa will tell you there is plenty of space within the parking structure to ramp it up. And so she has given us her word. There will be no problem. 15,000 next week, no problem, Elisa?
Yes, sir. We're ready to go.
And so we have complete confidence. So the other side is that Denise Fair and the health department have been running an outreach program to our most vulnerable folks who cannot get down to the TCF Center, our homeless, people living in senior centers, and now others. And so with this allocation commitment, we're going to go from 500 of our most vulnerable people in outreach to 1,000 a week as we go into the community. And with that, I'll turn it over to the health director, Denise Fair, to tell us how she's going to do that.
Thank you, Mayor. So let me just start with what we've been doing over the last 2 weeks. We have, in partnership with the Wayne State Medical School, we've now vaccinated 937 residents and staff, and 10 homeless shelters and 10 senior apartment buildings. But now that we have more vaccine, this means we can expand our efforts and continue vaccinating our most vulnerable populations. So now we're going to vaccinate at 3 to 4 locations instead of just 2 per day. We're going to double our outreach teams, double the number of people that we are vaccinating in the community. So this is great news. Beginning next week, we will now vaccinate 1,000 people per week, again at the senior apartments as well as our homeless shelters. This is up from 560 the previous week. Again, we are so thankful to the Biden and the Whitmer administration for the additional vaccine. This allows us to deliver this much needed vaccine to our most vulnerable residents and also the staff that serve them. Now, I'm also grateful to our community partners who know how big of an effort this is. And I'm talking about the Detroit Wayne Integrated Health Network. They're going to partner with us as we vaccinate staff and residents in mental health facilities, substance abuse recovery centers, and other supportive housing networks. And I do want to thank them for their support and partnership. Before I introduce you to Eric, I want to remind Detroiters that the vaccine is safe and the vaccine saves lives. And ultimately, this is a personal choice. And so I encourage you to go to our website at detroitmi.gov/health or give us a call, 313-876-4000. I want you to educate yourself on the vaccine so that you can make the best decision for yourself and your family. And finally, I want to remind everyone to stay safe. Remember those safety precautions. Wear your mask at all times. Wash your hands, avoid large crowds, and practice social distancing. And so with that, I'll turn it over to Eric Doa, who is the DWIN Deputy CEO.
Thank you so much, Denise. Very much appreciated. Thank you so much, Mr. Mayor. It's such an outstanding partnership here, and it's truly appreciated. When I got that phone call, there aren't too many phone calls that you get in the middle of the evening hours there when you have your 5-year-old running around trying to figure out what's for dinner. So it was quite a pleasant call. And, when we talk about our most vulnerable population in Detroit, it is something that is very personal to me. So for the 75,000 folks throughout Wayne County that we provide services for, when Denise reached out to me, obviously from the mayor's office, once again, it was just the mayor's leadership just being put on display here. And so for the 17,000 folks in Detroit within our setting, residential setting, who would have this opportunity, to get vaccinated, it is extraordinary. Make no mistake, our residential settings have been hit very hard with COVID. I mean, it has affected all of our families, but as you can imagine, when 6 or more persons live within a home, how one person testing positive can have such a grave effect on the rest of the folks within that setting. The same is also true for those direct care workers who provide such exceptional services, and I will be remiss to not mention them as we certainly sit here and talk about an opportunity for folks to get vaccinated. So when we talk about the 17,000 plus, make no mistake, those workers are also included in that number as well. Within the city alone, we have over 210 locations, and these are your residential settings, your what we refer to as adult foster care homes. These are also your SUD, substance use disorder, recovery centers, temporary housing. All of those are definitely in need of this. So when that phone call came, I don't believe that Denise was able to even complete the second sentence there before I said we were in. For Willie Brooks, who is our CEO, our board chair, our board, this is such an awesome welcome. And I know that, Mr. Mayor, as you always do, extending the thanks to those who have certainly helped, but I think it is extraordinary that you were able to reach out to us, and we welcome that. So from my board, the folks that we serve who've been asking these questions and wondering, when the vaccine were coming, it was nice to start to play some of those phone calls to say, hey, you know what, that much needed help that you've asked for, we have certainly delivered in our partnership with the city. So with that, Mr. Mayor, I thank you from the bottom of my heart, for what you have done for our most vulnerable population. Thank you so much.
So, Eric, we're glad to be supporting it. It has been a very intense couple of weeks, and I have been lobbying very heavily to unchoke the vaccine supply chain. And we're going to be up to 15,000 now. The day is going to come when you're going to be able to get your vaccines at your local drugstores and other locations. At some point in the spring or summer, it will open up, but right now at least, if you're in the city of Detroit, you can dial one number, show up at one location, you'll have a good experience. And with that, we'll take any questions.
Okay, Mayor, we have a number of reporters who have sent in some questions for us today. Christine Ferretti from the Detroit News wanted to know what we do if we have additional doses at the end of the day to make sure they're not going to waste.
So Lisa, you want to talk about that?
Thank you. So what we've been doing at the end of the day is reaching out to anyone who might be on a wait list. If someone came and they weren't able to get a vaccine because they didn't qualify, we reach back out to them. If there's any staff on site that needs a vaccine. So we've just been actively pushing for that.
We have a small number that were put in syringes. When your last person drives off, you may still have a handful of syringes left. And the team dials the number and everybody gets a shot. They don't throw any of the
Yeah.
syringes out, right?
Correct. No, we do not waste any syringes.
Great. And just so we're clear, Sean Lay from Channel 4 was asking a question that might seem obvious, but probably needs an answer, and that is that members of the public can't just show up and hope to get an additional dose at the end of the day, right?
No, currently we do not have that.
Don't walk out onto Atwater to see if anybody's there at 6 o'clock.
No, anyone just jogging by? No, we haven't had that, and we, like I stated, we are pretty accommodating. If there is someone who needs one, or it's the end of the day, and we have some extra syringes, we do not let them go to waste, and we are accommodating.
We see somebody on tomorrow's list that we know, we might call up and say, can you come down now? It's really a person-by-person phone call to make sure every single syringe gets used.
Okay. Sean Lay was also wanting your thoughts, Mayor, on the extent to which you think that your background in the hospital system may have helped you prepare for this type of a situation.
Well, at this point, my background, Conrad Mallett ran a major hospital. Hakeem Berry, our COO, who's over the center, was an administrator at the hospital system. Now Jay Rising, our CFO, was the CFO of the hospital system. Denise Fair was administrator in the Henry Ford system. I doubt there's a city in the country that has many hospital administrators in their entity. But we were all there at DMC in 2009 during the H1N1 epidemic. We had drive-through vaccines in 2009. This is something that we know, and we'll be judged on how we're doing. But based on the feedback I'm getting calls and texts every single day from people who went through that TCF center, and they are universally positive on the experience they had, the efficiency, the way they were treated. I think people feel really good about this.
Good. And Sean wanted to know if you have any suggestions for other cities or counties who may be setting up similar operations.
Yeah, we're talking to some. I know Jeff Zients intends to have a protocol for these mass vaccination sites around the country. I think they're planning to use National Guard in other places. I'm talking to the folks who are doing this. In the city of Detroit, we're very fortunate. We've got a huge indoor parking structure at a convention center. Most cities in the country don't have that. And we have Quicken, which use their affiliate Rock Connections to set up an appointment system with 80 operators. Other folks don't have that. They're relying on, mail-in, email appointment processes and the like. So, and then there's something about the city of Detroit where assembly lines are in our blood. So we got a whole lot of folks who have figured out how many minutes it takes to take each step, and they've been executing brilliantly. We're going to see what happens next week when we go from 5,000 to 15,000. We'll see if we're smooth.
Okay. And a couple of other questions. Annalise Frank was from Cranes is wondering why we're not doing vaccinations on the weekend at this point.
Because we can get through the 15,000 supply Monday through Friday. There's a point at which there's 25,000. We'll probably open up Saturdays. But the staff felt it was easier to add the 3 hours a day to the schedule, and they can handle the 15,000. So that's the reason. But at some point, we will be open on Saturdays. It'll probably be when we're doing 20 or 25,000 a week.
Okay. And at what point do you expect you would need to perhaps move to a second location?
We will, in about 4 weeks, we're going to have to figure out what we're doing, because the people who are getting 3,000 first doses a day, in 4 weeks will be getting 3,000 second doses, and we got to keep first doses coming. So sometime in the next 3 or 4 weeks, we're going to have to figure out another site, and we're very much into those discussions right now as to how we would do that.
Okay. Christine Hall from the Free Press wanted to know if the expansion at TCF with the additional capacity would translate to additional cost to the city.
Sure. We pay people by the hour, so it'll be more cost, but based on what we're seeing, we expect the city to be reimbursed by those costs. The appropriations coming out of the federal government for vaccine distribution, we assume we will be eligible. We did the same thing in March and April with the tests at the fairground. We started off, we didn't have a source of reimbursement. We just got it up and running to take care of people, and eventually the appropriations caught up and we were reimbursed for everything. And we're doing the same thing here. We are just going to get Detroiters taken care of quickly, and we'll sort the money out later.
Okay. Kim Russell, these are, I think, the last two questions on the vaccine. First one was, and you've kind of addressed this, is whether there's a plan to address any distrust in the community about vaccine usage.
Right now, we are just trying to get those who are anxious to get the vaccine vaccinated. We haven't had the supply for that. I can tell you from the rate of the calls coming in, it is obvious that as more and more people in the city know a friend or a relative who got the vaccine and didn't have a bad reaction, there's lots more folks calling. So I think the single best handling of the trust issue, and it's not just in Detroit, you're seeing trust issues in every community in this country, is the more people you know who got it and are doing well, the lower the threshold. But right now, it is going to take everything we have just to vaccinate those who are anxious to have it.
Okay. And last question from Kim Russell is, what are the options right now for transportation?
Right now, you need to get a friend to bring you. We will very shortly, we're out for bids, and I think the bids are in now. We're going to arrange something similar to what we had at the testing center for the fairgrounds. We will have free transportation for folks to the TCF center set up in the next couple of weeks. And we're doing that right now. In the meantime, we hope friends will pitch in, and we're seeing all across the city. I talked to one person who's taken 4 different people in for vaccines. This is the way Detroiters are.
Great. Okay, that's our last question on the vaccine, and so we're going to take a moment right now and bring up our next group to talk about Project Clean Slate.
Yeah, we have another major step forward, and for those who have criminal records and want a fresh start. And it would have been the major announcement of the day had we not gotten this extra vaccine dosage. So, Councilmember Janae Ayers, who's been the City Council's head of the returning, thank you, Art, the head of the returning Citizens Task Force for City Council, Stephanie LaBelle, who has run the legal aspect of Project Clean Slate, and we have Mr. Adele Davis, who is going to talk about his own experience, along with Assistant Chief Bedison, and at the back of the room is the brains of the operation, Kerry Jones, who is running this program, and Lawrence Garcia, our Corporation Counsel, is here as well. So, John, are we ready to start the?
Yep.
All right. We don't have the luxury of only addressing one problem at a time in this city. We have a lot of very talented people who committed a crime, served their sentence, would like to get on with their lives, and can't get records expunged. And so the city of Detroit has become the lawyers for our residents. I was here the last week, and one of those returning citizens is now the supervisor for the city of Detroit, running the alley cleanup crews. We've got returning citizens all through city government doing a great job, and all through pretty much every private company in the city. But last October, I was with the governor when she signed the new legislation that eased the restrictions. And I want to thank Representative Graham Fuller and really the entire Detroit delegation. This was a bill that passed last fall with bipartisan support. All of the times Republicans and Democrats are fighting with each other gets a lot of coverage, but when they sit down and work together, they haven't. And this law now takes effect on April 11th, so in a little over 2 months. And we're talking to you today because we want you to be at the front of the line, so when the law takes effect, our residents are the first ones to get their records expunged. Here's the way the rules have changed. The law of this state, as long as I can remember, said that if you had more than one felony, and it was more than 5 years old, you could not get an expungement. That is, you had to have one felony, more than 5 years old, to have your record be considered. So if you had a car theft case and an assault case from 30 years ago, and you were 19 years old, you could not get your record expunged. That wasn't fair. If you had only 2 misdemeanors, anything more than 2 misdemeanors at any point in your life, you could not get your record expunged 10 years ago, 20 years ago. And if you had traffic offenses, you couldn't ever get them expunged. And so what the legislature and the governor did is this. If you have 2 or 3 felonies more than 5 years old, in most cases you can get expungement. If you've got more than 2 misdemeanors, you can get expungement. And for traffic offenses other than DWIs and traffic accidents involving deaths, you can get your traffic accidents expunged. So if you've been to expungement fairs over the last 2, 3, 4 years, and you were told, sorry, you're not legally eligible, what we're saying to you is April 11th, there's a really good chance that you will be. And we've seen the numbers over and over. People who have gotten their records expunged are making an average of 25% more money the next year. This is a huge barrier to our residents being able to build the kind of lives that they want. And so, expungement is a complicated process. If you had to hire your own lawyer, it would be $3,000 or $4,000, and it would take a long time. So the city of Detroit is hiring your lawyers for you. So this team, our expungement team, is ready right now. They will be your lawyer, they will handle the process, and they will get you all the way through. You don't have to pay anything. We want you to succeed and stay in the city. We got thousands and thousands of jobs coming back here and being built. We want you to be eligible for those jobs. We want you to stay and build this city with us. This team has already expunged the record of 700 Detroiters, and the courts have been terrific. Judge Kinney, the chief judge of the circuit court, has streamlined the docket so that all the cases are heard at once. It really has been a team effort. Prosecutor Worthy has been very supportive of what we have been doing. So you can go right now to our website, detroitmi.gov, and if you go to the Project Clean Slate link, you can register today. Registration form isn't complicated. If you don't have access to the internet, 313-237-3024, and we'll talk you through the process. But you can go on today and register. Now, once you register, it's going to take 5 steps, and it'll be 6 to 9 months. But here's what you can expect to happen. The first thing is our staff will look at it and say to you, yes, these are the number of offenses you had, you are eligible. Or they may say, no, your last offense was only 4 years ago, you got to wait 5 years, call back in 12 months. But the staff will do the initial review and just talk you through with it as to whether you're eligible. If it appears you're eligible, we'll go to the second step. And the law requires you to get your past records. And so we'll have you come in to the police station in one of our centers. You'll get fingerprinted. It will pull up your criminal record, and that all goes to the lawyers to prepare your case. Once our lawyers have your records, they will file what's called an application to set aside conviction with the court. They can start filing these applications on April 11th. So if we can start this process earlier, you'll be that much farther ahead of the game. You're going to hear from Stephanie LaBelle for a second, who was responsible for most of those 700 that have already been successful. She has this down to a science, and you haven't lost any cases yet, have you? Okay, so far Stephanie is 700 out of 700 in success. So she's a real good attorney to have on your side. About 90 days later, you'll get a court hearing. And you'll go down to court, and Stephanie or one of the lawyers from the law department will go with you. They will handle everything. And by and large, the prosecutors have been extremely cooperative. It's been an efficient process. After the judge enters the order, you will get a notice in the mail 4 to 6 weeks later that your record, your conviction, has been expunged. We have dramatically simplified the process. and we will handle it for you. Because you live in the city of Detroit, your city government is fighting to give you a good chance. And then, once you've been expunged, I'm going to let Stephanie LaBelle tell you what happens next. Stephanie?
Thank you, Mr. Mayor. So post-expungement, we find out that your conviction has been sealed. And the way that we do that is we pull a new record just to make sure if there are any errors and it's still showing up, we will contact the court and get it straightened out for you. You may truthfully answer on employment, housing, and financial aid applications that the expunged arrest and conviction never occurred. So that will assist a lot of people with housing and other benefits. The general public cannot see a conviction once it has been expunged. Certain government agencies are able to do so. For example, the Michigan Department of Corrections, the courts, law enforcement, et cetera. Some of our clients have run into an issue where the expunged conviction is still appearing on their background report. If that happens to you, we will assist you with that because they are not automatically updating their records. We have had a lot of support from the community, and so I just wanted to recognize those people. We'd like to thank the Bendit Fund. We'd like to thank Mark Bernstein and Rachel Bendit, Bloomberg Associates, Bush Seaforth Law Charitable Foundation, Rose Gill Hearn, the Hudson Weber Foundation, the Sam Bernstein Law Firm, and the Simon Foundation, and also the Song Foundation. And we would like to give a special shout out to Bloomberg Associates. Under the leadership of Rose Gill Hearn, they have been a critical partner to us, and they've helped us develop a nationally recognized program. You can start this process today, as the mayor mentioned. Please visit our website. It's www.detroitmi.gov/Project Clean Slate. As the mayor mentioned, it's very easy to apply, and we are ready to get to work on your case. And with that, I'll turn it back to the mayor.
So, most cities in the country would leave you on your own to navigate this. The city of Detroit has made a significant financial commitment to this and has committed the law department staff to represent you. We were able to do that because we had a champion on Detroit City Council who has fought for this program to get started and fought for its expansion every step of the way. And I know she's very excited about the prospect that with this law being eased, we think we could expunge up to 1,000 Detroiters a year. But our leader on the legislative side, Councilmember Janae Ayers.
Thank you. Excuse me. So this is a fantastic announcement. The reality is 5 years ago, I became a council member, almost 6 years, geez. But when I came in the door, I came in with a story that was very much like so many other kids throughout the city of Detroit, where I had one parent that was working and one that was a multi-felon. And that's just what the name was, what the title was at the time. And so I recognized that I had something in common with so many different people. So it was supremely important for me for us to start the Returning Citizens Task Force because we had such a large amount of people that had the same story. And as a city, what are we doing to make sure that we create opportunity? And I think this legislation is doing just that. We're giving folks a chance to start over. We're giving people a chance to rewrite the narrative of what may have been their story, and not just their generation, but multiple generations that came before them and those that will come after them. And so we have to take a moment and say thank you, not just to the mayor or my friend Carrie in the back there, but to our legislative branch on the state level. Conviction, felony, mistakes, those things are not germane to just Republican or Democrat. And so this is an illustration of what that looks like when we put our differences aside and look at the things we actually have in common. So I will be fighting for some dollars to go and expand Carrie's staff because we have work to do. So thank you so much for having me.
And Chief Craig and the Detroit Police Department have been 100% behind this. This is the way we rebuild the city, is that when you finish your sentence, you get a chance to go work, be productive. So many people have started over. And in support of that whole initiative is Assistant Chief Todd Bettison.
Thank you, Mr. Mayor. And Operation Clean Slate is just so important, and it really helps. If Chief Craig was here, he would definitely say we cannot arrest our way out of this situation. And when I'm out in the community and talk to various youth, talk to young men, and even talking to various family members, it's a common theme. Individuals who have records. So this new expansion of the program will definitely be able to help a lot more people. And from the Detroit Police Department standpoint, we are going to be there, our officers, our staff. You'll even see me out at the centers. And we welcome our community. Come out, get a fresh start. Let's get those records expunged so that you'll have opportunity. It will definitely inspire hope. And I just know that so many folks are waiting and have been waiting on this opportunity, because this time it's been expanded to the point that you really can get a clean slate. So thank you, Mr. Mayor. Thank you, Councilwoman Ayers, and just thank you, Carrie, just the whole team, because it definitely will help uplift our whole city, our community. Thank you.
We're going to get a chance to hear from one of Stephanie LaBelle's clients, Adele Davis. Mr. Davis?
Hey, thank you, Mayor. Thank you, City of Detroit, for inviting me out and be able to give my synopsis of my story. I appreciate Project Clean Slate, and I got a little joke I call them my Charlie Angels. There's a very unique organization that changed my life again. You know what I mean? It put me in a better position. Project Clean Slate, I was going to another program called Detroit at Work. And at Detroit at Work, they had Project Clean Slate there. So I was debating because I was afraid that I wouldn't really get the help. I wasn't sure, I wasn't positive. The negativities, you got a felony, you have this background, they might not be able to help you. But I found out this project is an excellent project for the city of Detroit. And I really appreciate Project Clean Slate and what they've done to help me change my life and help get my life back in order. So I went to the city of Detroit again, and I talked to someone at the Project Clean Slate at the Detroit office, and the process just took steps from there to there to there. You didn't really have to do much. I might have had to go get some fingerprints or something very similar, very small steps that I had to take, and the rest of the ladies, to me, they did it themselves, even in the pandemic, that they took care of me at that time. But I'm very appreciative because it helped me free my life up again. It helped me regain my focus, and took the pressure off me of hiding that I had a felony. And then when I went to certain jobs to turn my resume in, I could not get the jobs that I previously were able to get. But I'm really grateful that it took that stress off and allowed me to become, the man that I am again today, with the positivity that I can go out and get a job. Matter of fact, I have started my own business called Helping Hands, Home Improvement, where I help remodel homes in the city of Detroit for people, and that's what I love to do. I'm a journeyman carpenter of the city of Detroit with Local 687, but this program is very, very, very helpful. And I would like to say to any man, woman, it doesn't matter, young, old, whoever has this issue behind them, you need to stop in and really check in with Project Clean Slate. I didn't even have to go to court. I mean, it went so well that I haven't even saw a judge. They took care of everything for me, and I really appreciate this. And I'm really glad that this organization is here.
Well, I'm glad, Mr. Davis, because we got a lot of houses in this town to remodel. We're going to have plenty of work for you. And so it gives you a sense of what we're doing. And, the staff at, I hadn't heard them called Charlie's Angels before, but the Clean Slate staff, it is a place of joy. I mean, they are every day helping people get a leg up. And as we said, those people who have had their records expunged, they're making 23% more money a year later. You don't have to write on your job application anymore, I've been convicted. You can honestly answer no when you've been expunged, and it just opens up so many opportunities. So with that, we'll take any questions.
Okay, Mayor, we have just a couple of questions from Orlando Brand Williams from the Detroit News. She wanted to know, with the expansion of the program, how many more attorneys will be assigned to the program, and will there be additional funding? And if so, how much?
You know the answer to that? Or does Carrie know the answer to that?
So we're working on funding right now. Carrie Jones is our team lead, and she's been amazing at doing that. Our hope is to hire at least 2 more attorneys, but we also need some paralegals. And so depending on our funding, we hope to do that soon.
And we have a friend on city council that'll help too.
And last question was whether or not there's any tracking of where Project Clean Slate clients end up going as far as future employment, and specifically, she wanted to know whether or not we know if any have been hired at FCA at the new plant.
Actually, yes, we have a survey that we send out to our clients post-expungement, and so they report certain things to us, and one of the questions that we ask is, what opportunities have you been given? And so one of our clients just informed me yesterday that he went from making minimum wage at a job to a position making $50,000 salary. And so, yes, another woman told me 2 days ago that she was hired in at FCA after her expungement, and which actually was a big wage boost for her. She was previously working somewhere else, but, so she was very grateful as well.
Okay, great. That's the last question for today.
All right, thank you very much.